Hi, I'm Dr. Chris Kuchenmeister with Stubbs Dental Implant Centers, and today we're going to talk about some of the different materials and pros and cons between dentures, snap-ons, and the All-On X Zirconia material. A denture is a full replacement option for somebody that doesn't have any teeth. A denture sits on gum tissue, so as you bite down onto a denture, it literally compresses down on your gums. That's one of the major limiting factors of a denture is the bite force. So the harder you bite, the more it compresses the gums and the more it hurts. So typically, from studies that have been done over the years, the bite force on a denture compared to natural teeth is around 20, maybe at a really good denture with somebody that has a lot of bone, maybe as high as 30% bite force, but that's a stretch for most people. The other kind of downside or down draw to a denture is that it also adds a lot of bulk in the mouth. So it covers the roof of the mouth. It also has a flange that comes up the sides, and so it usually adds bulk to the lip and the cheeks because it's adding material as it tries to wrap around that bone. But because the roof of the mouth is covered, it also inhibits the texture of your food and also the flavor of it because it's kind of blocking some of those receptors that we use to really kind of connect with our food and taste it and feel it. So without teeth in the bone or implants in the bone, that bone will atrophy over time, and so it gets smaller and smaller. Denture wearers that know about this problem, and they'll notice that as they have their denture for longer, the worse and worse it fits. So it becomes less tight, it tends to wiggle around more, and it doesn't stay put. So it disengages, falls down, or slides off, and that's a problem with dentures. And so one way that you combat this is that you reline that denture over time. So you change the inside of it to fit the gums. Well, that works for a while until the bone shrinks more, and then you've got to do that again. But the problem here is that denture gets thicker and thicker and thicker as time goes on, and it fits less and less well. So really we need to get at the root cause of this and use implants, or we can't use teeth anymore, but we certainly can use implants to help maintain that bone so that it doesn't keep going away. The really only upside to a denture is that it doesn't cost very much. It's just something that gets you a smile, you know. But we want more than just a smile. We want to get function, which is why we have other options available. The next option from a denture is to go to a snap-on denture. So like the name implies, it's still a denture, but it now has the ability to snap onto something to help keep it in place. So in order to do that, either in an upper jaw or a lower jaw, you would place usually anywhere from 2 to 4 implants into that jaw, and then the denture can then snap onto and snap off of those implants. So with a snap-on denture, one of the plus sides or upsides to a snap-on is that typically they stay in place when you're having natural, normal conversations. Whereas denture wearers are always a little bit worried that denture might dislodge or fall down while they're talking or laughing. Well, the limitation here is that there's only so much snap-on force that can be applied onto these. Remember, we have to be able to take them off. So there has to be, it can't fit so tightly on there that we can't remove them, which means that with enough bite force, you'll accidentally pop them off. Most people that have these type of appliances are well aware of this problem. So they'll take a bite of food and bite down on the right side, and because they're compressing on the right, the left will disengage or pop off. And so they're trying to learn how to chew on both sides of the mouth at the same time to try to disperse those forces, which isn't a real natural way to try to eat our food. We typically put it on one side and chew there, or chew on the other side, but we don't typically divide that food. And that's a learned habit that we have to try to train ourselves, which becomes really hard to do. The other thing with the snap-on denture is inside that denture is a housing that snaps onto and off of the implant. Those housings degrade over time, and so they wear out, and they do need to be changed. And that's usually anywhere from 6 months to a year for most patients. And so annually, you're having to pay to replace those housings as they wear out. That way they can still snap on tight and snap off tight. The snaps help hold it in place, but it doesn't support all of the bite force. So in moving from a denture to a snap-on denture, the overall bite force doesn't really significantly improve. You might go from a 25 to 30% bite force to maybe a 30 to 35% bite force, which isn't a real tremendous improvement, especially given the cost that you're putting into getting that snap-on with the placement of the implants. So that's why we've developed other options out there that provide significantly higher bite force than anywhere from 25 to 35% with the other options we've talked about today. Okay, so after the Snap-on, the next best option is the All-on X, the permanent option, which is such a tremendous option. But even in those materials, there's different options. So it can be permanent, but the teeth that you're biting down to can be made out of different things. The first one we're going to talk about is the hybrid option. Hybrid means that it's a lot of different parts kind of coming together to function. So on the hybrid, on the internal of it, there's a titanium bar that adds a lot of strength to the material. And then it's covered with acrylic that's pink to mimic your gums. And then set into that acrylic is plastic teeth. Now the hybrid option is considered a shorter lasting appliance because of the plastic and the acrylic. It tends to wear down at a much quicker rate because it's pretty soft materials. So usually people will have that anywhere from 2 to 5 years, depending on how much of a clincher and grinder they are, and also the types of food that might be incorporated into your diet. So that can wear that appliance out pretty quickly. So it's almost like a transitional permanent before you move to something better like a zirconia. Acrylic also has some drawbacks to it. It tends to be pretty porous. And because of those pores, it doesn't stay clean very easily. It soaks up food, it soaks up saliva, soaks up odors, and soaks up stains. And so you'll notice that that appliance tends to not look as good as time goes on because of the porous nature of that material. So a lot of our patients will go to the next option, which is the zirconia option. And zirconia is a tremendous material. It's extremely hard. It's a ceramic, and it allows us to, it's all made out of one material. So it's not a bunch of materials coming together to form a whole. It literally is entirely zirconia, which is why it's so strong. It's extremely dense, which means it doesn't have pores in it, doesn't soak up stain, doesn't soak up odors, and it holds its luster and its color really, really well as time goes on. So you're not worried that it's going to look dingy as time goes on, and it's going to degrade. And because it's so strong, it lasts an extremely long amount of time. It really is the gold standard when you're talking about permanent teeth. In fact, it's the same material that we use to make crowns. For somebody that might have a posterior tooth that needs to be really strong to support bite force, we use that same material for natural teeth as well. So it has a lot of applications and is a really, really good option. So as you're working with your dental provider in making that zirconia permanent teeth, you want to make sure that you're spending a good amount of time with your provider really fine-tuning this process and making sure that it looks the way you want it to look. Zirconia isn't a material that you can change. So once it's processed and done, it's done. So we can't add to it later or say, oh, I want a different color. It needs to be perfect right out of the gate. And so make sure that you're working with a provider that's, or an implant center that's really going to do that, and spend time to really fine tune the look for you and make it custom to how you want it to look. Because zirconia is such a great option, it's so strong that it really holds up over time. Compared to other options like a denture or Snap-on denture, or even the hybrid permanent option, you're going to need to be replacing those as time goes on. Whereas that zirconia can hold up for years and years and years. It truly is the highest rated, and you'll probably save money by not having to replace those other options as frequently because the zirconia is going to last for the long haul. The doctor providers at our implant centers have been doing this for a long time, and they really know a lot about not only the procedure itself, but the materials. And one of the reasons is because we own our own lab. So that gives us the ability to learn about the materials, to stay on the front lines of what's current, what works and what doesn't work. And it allows us to give you a product that's kind of quality controlled because we controlled this process from start to finish, which is one of the great benefits of our implant centers. Our providers are very knowledgeable about this process. If you have any questions, please feel free to give us a call. We'd love to explain what your options are and kind of walk you through those steps so that we can get you the best care, not just in the short term, but in the long term as well. We want to build you something that's going to last and look good. Thank you.